to the Rundown with Dr. Ciarrah, where we discuss all things running. If you are new and this is your very first time, then welcome. And if you're not, then welcome back. Today we're talking about how to avoid common running injuries. More than 80% of runners who have some type of injury, it is caused due to repetitive stress. As runners, I know we all have our goals. We have our time frames of certain things that we want to accomplish. And sometimes we ignore, if possible, those minute injuries that we feel like we can get past, and we honestly may be doing ourselves more harm by doing so. So today we're going to talk about how to avoid those injuries and how you can keep yourself healthy so that you can continue to run. When we look at injuries according to body region, the knee has the highest percentage of injuries. And most commonly, it's from runner's knee, which is also known as patellofemoral syndrome. There are a lot of other injuries that happen in the body, such as your IT band, Achilles tendonitis, shin splints, you have plantar fasciitis, you have muscle strains, ingrown toenails, believe it or not. Their list goes on and on. We're going to go through some of them, and we're going to just discuss some things that you can do to kind of help avoid these injuries as much as possible. It is likely with some of these injuries that the treatment is going to sound similar. That's because there's three main things that I believe that need to take place when you have an injury. The first thing is rest. The second thing is strengthening, and the third thing is stretching. So we'll get into how those each will play a role into the injuries. Injury prevention. What do we have to do to make sure that we don't get injured? Well, I'm glad you asked. The first thing that we need to discuss is stretching. We talked about this in our previous video, dynamic stretching. It is very, very important to incorporate some type of stretching into your routine. You don't want to just hop out of bed and be like, okay, I'm ready to go running. You need to allow time for your body to warm up. So that's where that dynamic stretching comes into play. It is very useful that your muscles are warmed up with active motion versus just static stretching and you're just standing there. So that will help your muscles get ready to realize, okay, we're getting ready to do a rigorous activity, and they won't be so surprised when you start running. Secondly, we need to talk about your load. So if you already know that you are having knee pain or you're having ankle pain when you're running, you need to take a step back. When you have those nagging injuries, those are things that you should not avoid. Something that is nagging and is there all the time, the more that you ignore that injury or nagging pain or whatever the case may be, in the long run, you're going to end up making it worse. So if you notice something, fix it. Don't wait for it to break. Let's be proactive in the things that you're feeling and the things that are going on instead of making it a bigger problem later on. Now, if you are coming back from an injury and you are slowly trying to work your way back into it, you want to start with the 10% rule. You do not want to increase your running greater than 10%. Start slow. Soft surfaces are important to save your knees while you're running, and I understand that the most accessible place to run is outside, which means that you're running on concrete. However, if you are mindful of like your injuries and you're wanting to prevent it, I would suggest running on a treadmill, running on a rubber track, just so that you can save your knees, absorb some of those forces, and it not put so much stress on your knees, your ankles, just all of your joints in general. The other thing that I think is important to help you prevent injuries is to make sure that you're incorporating cross training. That is so important because you need to do other things that can give your joints a break. That repetitive stress of running every single day is going to wear and tear on your joints over the years. I know you may say, oh, well, I've gotten up for the last couple years and gone running and I haven't had any injuries. I'm just talking about long term. You have to be kind to your body, number one, but also like number two, if you want to continue to be able to run, to be able to do all of those things, just incorporate another activity so that you can have a day off, so that your body is able to rest. And I know that we talked about incorporating rest days in some of the other videos, but just doing other things so that it's not so much stress on those joints would be beneficial to help you prevent injury. So now let's talk a little bit more about those common injuries that we see. So let's start with runner's knee, which is also known as patellofemoral syndrome. It's likely with this type of injury that you're noting some dull, achy pain in the front of your knee, around the patella, which is also the kneecap. Now, the reasons that you have that pain can vary from person to person, but some of the common reasons that are seen are because, one, you have a weak quadricep, or you may have a tight hamstring. It can also come from repetitive stress or trauma to that knee area. Now, with this one of the three that I mentioned earlier, the rest, the strengthening, and the stretching, for runner's knee, I think that strengthening is the most important one. Because if that quadricep is weak, then you will continue to have problems when you go to run in that knee area. Now, one of the things that I would kind of check and see or make sure I focus on, especially in the rehab part, is am I able to do my single leg squat? Is that difficult? How do I feel when I'm doing straight leg raises? These are all things that can focus primarily on the quadricep muscle, which is going to be the main thing that you're going to want to focus if you're experiencing some runner's knee. Now, if you didn't experience it, it's still beneficial for you to do these exercises so that you can avoid it. That's our whole goal, to have healthy knees, healthy, strong bodies. So we want to avoid these things. So pay very close attention to your quadricep muscles. Not only is the strengthening important, but it's also important for the dynamic stretching. So like I said, before you get ready to do anything, make sure that you're warming up those quadriceps. The quads are one of the biggest muscles when you go to run. They're actively being used, the quadriceps and the hamstring. So if you're not stretching anything else, make sure you stretch those quads and make sure you stretch those hamstrings. You want those to be as loose as possible so you don't have any issues when you go to run. So next, let's talk about Achilles tendonitis. So if you are experiencing this, it's likely that you have some heel pain, or maybe you have a tight calf, or maybe even a weak calf. Now, in order to prevent this, we want to certainly make sure that we're incorporating stretching. This is important because that Achilles can get super tight, so you want to make sure that it's pretty pliable and flexible when you're getting ready to run so that you don't cause additional irritation. Now, shoe wear is also very important with Achilles tendonitis. Again, because as you're running, your feet are what make contact to the ground first. It is what is going to take that shock first, and so if you have the proper shoes on, it will help to absorb some of those forces a little bit better. Now, you also can look at your shoes on the bottom. You can kind of see where the wear is, and that will help you determine whether or not it's time for you to get a new pair of shoes. I like to do 6 months to a year depending upon how frequently you're running, but that's just something to think about to help to prevent further injury. You don't just want to run in any shoe. You want to have dedicated running shoes only, and you just want to make sure that you're doing those stretches, especially if you're having some irritation with your Achilles. Now, you can also experience Achilles tendonitis if you have super flat feet, or if your feet are pronated when you're running and they're kind of going in. And if you have those issues, I would definitely seek or reach out to a physical therapist who can further help you, because you don't want to just try to tackle it on your own. You want to make sure that, one, you're diagnosed correctly, and then two, that you're doing the proper exercises so that you don't have any further injury. Next, we're going to talk about IT band syndrome. So that's your iliotibial band, which runs from your hip down to your knee. And a lot of times there is a lot of irritation on the lateral part of your leg, and it can also have some problems at your knee, or it can have problems at your hip. It just kind of varies, and it depends because everybody is unique, and how it presents in one person may not be the exact same in the other person. But with this syndrome, you want to make sure that you're stretching. Now, one way that you can stretch is with this picture. Now, you can do this stretch and you can do it often. Now, some people will use a foam roller for this just to kind of keep it pretty flexible, which I think is important just in general. You want to keep your muscles pretty flexible. You don't want them to be super tight, because when you're running, then they're just going to tighten up even more. So pay close attention to how much you're stretching and how much you're keeping those muscles pretty flexible. It's very very important when you're running. And it's not just for your legs, it's for your lower back, it's for everywhere. You want to make sure that your body is loose, because when you're running, those muscles just tense up. So if you're starting off tense, it's just going to set yourself up for even more injury. And that's the exact opposite of what we're trying to do. We're trying to keep you nice and healthy. So I want you to just try this IT band stretch. I want you, if you feel like it's necessary, go ahead and do some foam rolling to help keep those muscles pretty relaxed. And then also you want to make sure that you're doing as much as you can to be active. Now, you don't want to overdo it, because that's when it gets irritated. So you just need to find a healthy balance, but making sure that you're paying attention to incorporating those stretches into your routine. Now, I know that you are already doing other stretches, because we've been talking about keeping those dynamic stretches up at the beginning of the routine. But if you notice there's a certain area that's tight on your body, you want to make sure that you pay super close attention to that, and you want to make sure that you incorporate it. Now, the things that I'm saying is not just, okay, just only do that. You have to do a whole realm of things, but I'm just saying pay close attention to that particular stretch if you're having any problems in that area. Also, with the IT band, you want to make sure that you're incorporating rest, because a part of the problem is that those tissues that are around that band, they're becoming irritated, and so you don't want to continue to inflame those tissues. You want to allow them some time to kind of calm down and relax. Now, you're going to continue to irritate them even more if you keep running. I always, I don't like to tell people, oh, you can't do this, you can't do that. However, you have to do what makes sense. So if you're running and it's causing you pain, then back off from it and just incorporate something else in the meantime. Stay active so you don't lose your momentum of working out or getting your runs in. But at the same time, you have to be smart, because you don't want to injure yourself even more. All right, let's talk about shin splints. They're super uncomfortable. I've had them several times, and it's something that you cannot ignore. I talked about earlier, if you have nagging pain while you're running, you want to treat it sooner than later. Now, the tibia, which is that very front bone in your leg, that's where you're experiencing that pain. Now, around it, those muscles, those tissues, they are super irritated. That's why you're having that pain while you're running. How do you avoid that? You avoid it by paying attention to the surface that you're running on. I know, again, that concrete is just like so tempting. Like, let me just get out and get this running. It's very quick. I don't have to hop in the car. I don't have to drive anywhere. It's the most convenient, but it's also one that can really cause injury. So if you can, run in the grass. If you can run on rubber, find a track. If you can run on the treadmill. I said that before because it's very important to make sure that you're being mindful of that surface. You don't want to make the injury even worse. Now, again, this is where rest comes in. You really need rest with shin splints. It's not something that you can be like, okay, I'm just going to take a day off. No, you really need to take some time so that those muscles can heal. There, you have like mini micro tears in those muscles, so you want them to heal. Now, in that time frame, I'm not saying that you want to just completely avoid doing anything, but this is where your cross training comes in. You can go swimming, you can ride your bike, you can do a lot of other things to get your heart rate up that don't involve you putting that same stress that you would experience when you're running. Plantar fasciitis. Now, if you're a runner and you've gone out for a run, and maybe that next morning you wake up and you put your foot down on the ground and you just have this excruciating pain in your foot, then you know exactly what I'm talking about. Now, it can be very painful, especially if you are, let's say you are a woman and during the daytime you're wearing heels and then you go for your run. Going back and forth from one type of shoe to another where your foot is being stressed in different ways can sometimes be that irritation that occurs. And even for men, if you wear, let's say you wear your dress shoes to go to work, and then after work you're like, okay, I'm going to go for my run. Now, if your foot is not acclimated to doing that, it can increase the pain, especially when you're running. You can cause yourself to have that plantar fasciitis, especially if you're doing a lot of walking in like a flat shoe throughout the day. Now, with plantar fasciitis, I would say that you may need to get your feet assessed and see if you have flat feet. Let's say you're over pronating while you're walking. You could be over supinating, and those just mean either you're walking with your feet turned in or maybe you're with your feet turned out. Either way, both of those can cause irritation in your foot because you're putting extra stress in different areas of your foot. Now, I would say that I would look into maybe some inserts for your shoes while you're running or even while you're walking during the daytime, just so that your foot has that extra cushion and they're not stressed depending upon the type of shoe that you're wearing. Now, it's very important because if your feet are hurting while you're running, how can you run? Like you can run in pain, but we don't want you to do that. This is all about injury prevention. So I would look into getting some inserts into your shoes that would help to absorb those forces. And then also, I know they sound silly, but there are a lot of toe exercises that you can do to kind of help. You can do calf exercises to help strengthen those muscles in that area. Like you just have to think of your leg as a chain. So if you're having issues in your foot, it's likely that it's throwing everything off in the rest of the chain. That's including your knee and that's including your hip. And it goes vice versa. Like if you have hip pain and there could be something going on in the knee, it could be something going on in the ankle. It just all depends. But you just want to look at that leg as a chain. It's like, okay, my feet are hurting, but I need to make sure that the muscles that are around my feet are strengthened so that I don't cause injury any other place. So just be mindful, especially with those feet. This is when the shoes come in, the inserts if necessary. You want to make sure that you're stretching those muscles in your foot. I know we talk about a lot of the larger muscles and stretching those, but let's not forget about the feet, because without the feet, there would be no run. So you can do a lot of exercises to help strengthen those muscles in the bottom part of your foot. If need be, you can get you a water bottle and use that to kind of help. There are plenty of things that you can do to make sure all of those muscles are pliable and stretched and well stretched prior to those runs so that we don't cause any further injury. Now, rest also is important here because if your feet, again, like I said, if your feet can't withstand those forces while you're running, then we're only making the problem worse. So just be careful when you're like, okay, one day I'm okay, and then the next day is not. That means you just need to take a step back and then get some rest in prior to those next runs. And this is again where I talked about that 10% rule. So we want to start small and then you build your volume up by 10% to see if you're able to withstand that force. And if not, then take a step back. But you just want to make sure that you're not just jumping right into it just because I run 5 miles a day and I have to do it. I have to get those 5 miles done. You don't want to make a bigger problem for yourself. So listen to your body before you're just like, okay, I know I can get past this. It hurts a little bit, but I'll be okay. No, because then maybe a week or two later, or maybe even a month, a year, there's no set time frame. But later down the road, you're like, if I just would have stopped then, I still would have been able to run now because I would have taken care of the problem versus just trying to fight through it. It's not always no pain, no gain. Sometimes you have to address those issues or you're just making it worse for yourself. Now, if you do experience a muscle strain, rest is going to be imperative. It is something that is going to take time. You have to listen to your body. If you're still having pain while you are doing basic activities, then you need to take more time. Now, one of the things about muscle strains is that they can happen anywhere in the body. It just all depends on what activity that you're doing, what your activity level looked like prior to you doing it, because a lot of times it happens when you don't prepare the body, when you don't stretch prior to your running. And if you haven't done it for a long time and you just try to jump back into it, your body is almost in a state of shock. And it's like, what are we doing? And that's how you have a muscle strain that can happen. And I mean, oftentimes you see it happen in the back or in your hamstrings or in your calf, just from when you're just doing a basic run. But that just depends on the mechanics of your runs while you're doing it. And so you just have to be careful and pay attention to everything while you're running, especially you have to stretch. That is so important. I can't say that enough. You can't just hop up and go running or else you are going to injure yourself. So if you are a person who want to continue running, then hear me when I say you need to do some dynamic stretching prior to your runs to prevent the strains, to prevent all the injuries that we've discussed today. You want to keep your body healthy. The last injury that we're going to talk about is an ankle sprain. Now, how many times have you been running and let's say you're outside, there's like something on the ground that you don't see, or there's some uneven cement on the sidewalk and you kind of just like turn your ankle out. Now, of course, there's different grades to an ankle sprain, but if you have one that's pretty bad, then you're not going to be able to run for some time. I mean, all of them are going to require some level of rest. However, depending upon the severity will depend on how quickly you're able to return back to running. Now, of course, we're going to use rice. You're going to rest it, you're going to ice it, you're going to compress it, and you're going to elevate it. Now, that is something that is super important because you want to attack it as soon as this happens. Now, if you find yourself that you consistently have ankle sprains or you roll your ankle very easily, then something that you 100% need to be doing is some ankle strengthening exercises. The reason that it keeps happening is because your ankle is not strong enough in order to withstand those forces while you're running. So if you notice that you keep rolling your ankle out or that you're having sprain after sprain, you definitely want to make sure that you're incorporating some strength training for your ankle. Now, it can be done many ways. You can do it sitting down, you can do it standing up, but it's just something that you definitely want to start doing so that those muscles can be stronger and so you don't have to worry about the stability of your ankle when you're running. So today we talked about a lot of different common injuries that are seen with runners. Now, we know that this just happens because running is such a dynamic activity, that repetitive force when you're hitting the pavement every time, and a lot of things can go wrong with your body while you're running. But because you're a knowledgeable runner, because you're a proactive runner, and because you want to stay healthy while you're running, you're going to use these tips that I gave you today so that you will not have these injuries. Now, remember, the three things that you can apply to almost all of the injuries that we talked about today is that you're going to rest it, especially if you already have an injury, but to avoid it, we're going to make sure that we're doing our stretching and that we're doing our strengthening to the muscles that are surrounding the injuries. Now, I just want you to be smart prior to any run that you're doing. Stretch before you run. Listen to your body. Make sure that you're taking the time out to do all the things that you need to do so that you can continue to run and you don't have to stop for rehab. Now, if you do, then I want you to make sure that you're talking to your doctor, be correctly diagnosed, and that also will take place when you go to see your physical therapist. And then also just be consistent. Whatever it is that you're doing, don't just stop and then come back to it whenever you feel like it. Make sure that you set up a regimen for yourself. You want to make sure that you are keeping your body as healthy as you possibly can so you can continue to enjoy all of your runs. All right, well, guys, that is all that I have for you today. I hope that you enjoyed this week's episode of The Rundown. If you like this video, please like it, subscribe to this channel. We have many more videos coming to you. I want to hear down below in the comments how these tips are helping you. And also, if you have any questions, please just let us know. We'll see you next time on The Rundown with Dr. Ciarrah.